On June 6, 2016, Dr. Terry Stock traveled from Omaha to Allen Hospital to begin work as a locum anesthesiologist. Dr. Stock completed orientation and was in the surgery department preparing for his first case. Dr. Stock was taking a noticeably long time to emerge from the locker room and begin his first case in the OR. Susan Rodgers sensed something was wrong. She sent someone to check on him and noticed he did not look well when he exited the locker room. Dr. Stock sat down to rest on his way to the OR and informed Susan he was experiencing chest pain radiating down his left arm. Susan promptly transported Dr. Stock down to the emergency department. She left Dr. Stock in the hands of the ED staff at 8:43 a.m. Ron Schlatter was the first nurse to care for Dr. Stock, while Dr. Bob DeCoster quickly assessed the situation. It didn't take long for the diagnosis. STEMI alert. By 9 a.m., only 17 minutes later, Dr. Stock was on the table in the cardiac catheterization lab on the second floor. The cath lab team prepared to investigate the blocked artery and treat Dr. Stock. Cardiologist Dr. Jowd Deeb was on his way to the hospital when he received a call notifying him of the situation and that a patient was suffering a heart attack. When Dr. Deeb arrived, the cath lab staff, that included Jessica Davidson, Ken Wanschneider, and Sarah Wedgeworth, discovered a blockage had occurred in the coronary artery that supplies blood to the top of the heart. This particular artery has two branches, and Dr. Deeb determined bypass surgery was the best option. With a call to cardiothoracic surgeon Dr. James Wright, Dr. Stock was transported back to the OR to prepare for open heart surgery. Dr. Wright spoke to Dr. Stock's wife, Nadine, in Omaha and informed her of her husband's condition. While Dr. Stock has seen these situations before as a cardiovascular anesthesiologist, Dr. Wright aimed to calm Nadine's fears, answer her questions, and recommend driving carefully to arrive in Waterloo just as her husband was coming out of surgery. Dr. Terwilliker was another source of reassurance for the Stock family. As a fellow anesthesiologist, Dr. Terwilliker provided comfort to Dr. Stock by delivering care just as he would have in a similar situation. Down a critical member of the surgical team, schedules were juggled and communication was critical as everyone stepped up to provide the very best care through unique circumstances. Dr. Stock was transferred to the ICU just as his wife and 3 sons arrived at Allen Hospital. Sarah Bischoff and Matthew Faust are the nurses who cared for Dr. Stock and assisted Dr. Wright in educating the family and making them as comfortable as possible away from home. Dr. Stock was transferred to 3 Heart the next day. He was discharged on post-op day 3, and case managers coordinated care with cardiologists in the Omaha area to ensure successful recovery. Everyone involved in Dr. Terry Stock's care truly fostered unity to deliver the best possible outcome in a difficult situation. At 54 years old and in good health, Dr. Stock suffered a heart attack. He went from the Allen Hospital Emergency Department to the cardiac cath lab to the operating room, all in less than 2 hours. It took significant teamwork and cooperation to get Dr. Stock back to Omaha with his family.